Welcome back. We're still talking about cleft lip and palate, and you can call in with any questions you might have. Perhaps you've seen somebody or you are related to somebody with this kind of condition. The number to call is 0808 054 2233. That's 0808 054 2233. And you can always tweet at CTV_Mary A. So we were talking about manner of feeding.
Manner of feeding.
Is the positioning of the baby important?
Yeah, I was going to come to that. The positioning of the baby is also important. The baby is supposed to be sat upright and fed. Now, if there's a cleft of the palate, it is usually very difficult for the baby to feed directly from the breast.
Okay.
It is usually very difficult because the baby is not able to mount enough suction to take in this fluid. So that's why the essence of the various special feeding bottles come in.
Oh, there are special feeding bottles.
Special feeding bottles for cleft palate patients now. There are about 4 different types now. There's one called the cleft lip and palate nursing bottles. We have the Ned Johnson and quite a number of them.
Okay, so let's talk about surgery. You do a surgery early in infancy for the child. Wouldn't it pose a problem later when maybe the head is getting bigger, teeth are starting to come out? Wouldn't you need some sort of adjustment since a surgery is at best a man-made thing?
No, there won't be any need for that.
No need for expansion of the palate?
No need for expansion. Though a lot of school of thoughts came up on when to repair a palate, for example.
Okay.
Some people felt that, okay, let's repair it early, even in utero. Some people said no.
Has that ever been done?
No, yeah, abroad. People do all that abroad. In utero, they repaired left
in the womb.
Yeah, yes. Even before the baby is born, that reduces the anxiety to the mother.
Definitely.
And they said, well, scar, it doesn't allow for scar tissue. But people who are against that believe that if you do that, it can affect the jaw, the maxilla. The maxilla might not form properly. And also, there are anesthetic challenges to that. So I'm not aware of anywhere in this country where that has been done.
Okay.
So what we do in Nigeria is following these guidelines, the protocol I mentioned earlier for the lip. Then the palate, we usually wait till like 9 to 18 months. At least it is better done before the baby starts producing speech.
Okay.
So that when you did before the baby produces speech, that you are sure that at least to an extent, the speech will be normal. But that's why you notice that a lot of adults with cleft palate that are unrepaired.
Yes, I was going to ask you, people actually grow up with this condition?
A lot.
How do they live?
Yes, they're talking about how they live. Most people in the society don't see them as normal.
So they are discriminated against? Yes,
they are discriminated against. We have had a case of a baby that was banished from a worship center because they felt she was devil or devilish.
Just because of the cleft
the mother and the daughter were banished. Somewhere in Ogun State, they came all the way to Lut for the repair. We have had a case of a patient that was sent away from school because the head of the school felt the other students were being scared away.
By him? By
this patient. So the awareness needs to be increased so that people will know that these are normal children, they lead normal life.
But how easy is it to repair the clefts when the child has grown up?
It is even easier to repair when the child has grown up because you have a lot of tissue to handle.
Okay.
That is the beauty of adult repair. And like if I want to tell you to repair a cleft lip is about 30 minutes procedure. And another advantage to it is that you can even do it without putting the patient to sleep. Because, yes.
Wouldn't that cause a lot of pain?
No. The patients will be given medications. You do all the things you need to do to reduce the pain.
And just a 30-minute procedure?
This is a 30 minutes procedure.
Okay, 2 questions arise now. First of all, it seems as if a lot of people are very ignorant about this. Yes. So we might have quite a few clefts walking about.
Yes, quite a number are walking about. Quite a number are walking about. In Lagos University Teaching Hospital, where I trained, about 800 or 900 have been done in the last 7 years.
Wow.
900 patients.
Let's take this call. Hello, Chinedu. Hello, Chinedu. You're on now. What's your question?
Yeah, I'm watching your program, which is on cleft lip. Hello, are you hearing me?
I can hear you clearly.
Yes, as I'm watching your program, I'm watching your program, and I have a 6-year-old daughter, and what you are discussing seems to be a condition health. My question is this: is there any? My daughter seems to have this problem.
Okay.
And my question is, what is the solution? Because somebody told me that she must undergo a surgery.
All right. Thank you very much, Chinedu. I believe you've answered that question, but could you quickly reiterate for Chinedu?
Yes, there's solution for your daughter. Your daughter will need to present at a hospital, Lagos University Teaching Hospital, LASUT, Igbobi, and some private
all
hospitals.
The government-owned hospitals do it.
Let me just say this. There's an international organization called SmileTrain that is sponsoring free surgeries for cleft lip and palate for the past 10 years thereabouts. So patients don't need to pay if they present at a place where SmileTrain is sponsoring these surgeries.
Would that be LUTH?
LUTH, Lagos University Teaching Hospital. Like I said, LUTH has done about 900 in the last 7 years thereabouts. I know they're doing LASUT, Igbobi, and the lucky thing is that some private hospitals too now have.
And it's free.
It is free as long as it is sponsored by SmileTrain. Because, like I said, if a patient presents at your hospital and there's no SmileTrain grant in the hospital, the patient has to pay. But
what I'm trying to ask you is, if Chinedu, for example, takes his daughter to
LUTH,
does he get it free?
He gets it free. You should just take his daughter to LUTH and he gets it free.
Okay, so Chinedu, that's for you. Cleft lip and palate surgeries free at LUTH right now, and other
hospitals,
publicly owned hospitals. That's very great. Now, after the surgery, maybe the next week or so, how do you feed your patient? Can the person chew? Just a minute before you answer that, we have a call coming in. Hello, Mike. Hello, Mike, you're on. Mike, we've lost Mike. How do you feed your patient?
Yeah, the patient feeds normally. Immediate post-op, maybe...
I'm really puzzled because operations are synonymous with blood flow, cuts, pain.
Yes.
So somebody just comes out of an operation which you probably didn't put him to sleep for, and you say he can just eat?
Yes, and that's how we usually have our protocols. When you do an operation, you allow some time before feeding can take place through the normal processes, through the mouth and co. Immediately we do the operation, the patient will still be on fluid. Maybe after 6 to 8 hours, thereabouts, if it's done under GA, that's general anesthesia, then patient can start feeding normally, graded oral feeding. Of course, not like patient will start swallowing.
Okay, so you
solids,
start from liquids.
Liquids, clear fluids, move up to things like Sprite, move up to tea, custard, rice, then the main solids.
Full blown.
Yes.
How long does it take approximately to recover and be fully back on the table like every other person?
2 days. Patient,
2
yes.
days.
2 days. Like in 1 or 2 days, patient will start eating, feeding normally. In 1 or 2 days.
Okay. Now, how many surgeries approximately does a patient need? Because we're talking of the lip, we're talking of the palate, sometimes we're talking
alveolus,
of the hard one, the soft one, the alveolus, problems with the teeth, so many things.
Thank you very much. There are different school of thoughts on how these things are done. But like I mentioned the other time when I was talking about primary alveolar repair, when you're repairing the lip, you can also repair the alveolus. That's the bone at that time.
The bone that,
carries the teeth. You can do that. Then if you repair a lip, if the patient has cleft of the lip, alveolus, and palate, you can start with the lip at 3 months.
Okay.
Now, if you want to repair the alveolus at that time, you can too, because there's room for primary alveolar bone grafting. Now, you can now wait till like 18 months before you do the palate. After the palate, you can then do the alveolus. If you don't do it primarily, you can now do it secondarily when the patient is around 9 years old.
Okay, so throughout the patient's life, there might be one operation or the other.
Yes. These things are individualized, because if a patient is 17 to 21 years old, is just coming to the hospital, has lip, palate, and and the alveolus, the surgeon can decide to do, based on what the patient presents with, can decide to do whatever he wants to do. This patient is already late. He came in late. Someone that is 21 years old, has cleft lip, alveolus, and palate. The surgeon might decide to repair the three.
Okay. Finally, since this is in the face, so near the brain, are there any implications for intelligence? Does it reduce the intelligence of the child in any way?
No, it doesn't reduce patients' intelligence. Patients are normal. Patients are normal, but in cases where we have some syndromes associated with cleft lip,
okay,
because there's about 500 syndromes associated with cleft lip.
So there are some comorbidities.
Yes. So if you have some patients that have some Down syndromes and still come down with, so you know that will affect intelligence.
Yes.
But generally, patients that are not syndromic cleft, that is, they don't have syndromes, comorbidities associated, they live life like normal children.
And they are as intelligent as the next child.
Yes.
Terrific. Thank you so much, Dr. Alawode. That has been really interesting.
Yeah, it's a pleasure. Thank you very much.
Thank you so much for being with us.
Thank you very
You're
much.
always a pleasure to be with. And thanks for your calls. Chinedu, Mike. Have a great day. I am Mary Alale Yusuf.
Thank you.